Jam
is roaring into the Macon Coliseum April 18th through the 20th with 4 awesome shows featuring Monster Jam trucks, world champion drivers, freestyle competitions, gravity-defying stunts, and heart-pounding races. The whole family will enjoy lots of action and excitement.
coming to Macon Coliseum.
Start the fun early at the Monster Jam Pit Party. Get revved up with Monster Jam Trackside Experience. Meet the superstars of Monster Jam. The competition is fierce as 8 top drivers battle it out for a spot in the Monster Jam World Finals. Don't miss the 2025
Monster Jam.
coming to the Macon Coliseum April 18th through the 20th. Tickets available at Ticketmaster or get your tickets now for only $12 with coupon. Use offer code MJMBP. $12 coupons are available at
Macon Black Pages.
For more info, visit monsterjam.com.
Monster Jam.
As big as it gets.
We want to say hello to everybody out there in radio, TV, internet, and other lands. We've got such an important show for you today on a call to action. We want to talk about something that's life savings. You know, oftentimes we have problems or faced with situations that are preventable because we are not fully familiar with the resources that are available. And specifically, today we're going to talk about mammograms. You know, cancer in many instances is a very prevalent thing in our society, but the sad part about it, particularly breast cancer, is that there is a process wherein breast cancer can be detected and treated, and in some instances maybe curbed, where it will not last as long. So today we're very fortunate to have Miss Latasha, and I'm going to just say Latasha because I want her to introduce herself using the name that she loves to be called. And she's going to, first of all, Latasha, let's give us your position at Atrium Health and how you would like for us to refer to you.
Well, first, thank you, first of all, for having me. And my name is Latasha Hill. I'm the service line, breast imaging service line manager here at Atrium Health Navicent. I've been with the organization now for 19 years, and I'm excited to share all things about breast health and our new mobile mammography program that we launched in January of this year.
Okay, you said breast health and your new...
Our new mobile mammography coach that we launched this year. Yes.
I'm glad you said mammography because, you know, that's the correct way to pronounce it. New mammography mobile. Now, let's talk a little bit. You know, I saw last night during my research where 1 in 8 women, you know, will one way or another suffer from breast cancer. I also know that it can be reduced significantly. And then part of my motivation is, and I'm sure it's yours too, is to just really encourage people, you know, because if it's detected, you know, I know we all know about early detection, you know, so just talk about a little bit about the importance of having a mammogram and what that entails. And then we're going to get, and then Lord have mercy, as my grandmama used to say, we've got it situated where you can take it, you know, you can just, hey, it's more.
Right there to you.
Yeah, just, you know, so one of my favorite expressions that is no excuse now, no excuse for not, you know, really being checked and having a mammogram for to determine if one has breast cancer. So just talk a little bit about why it's important and what the process involves to be checked for breast cancer.
So mammograms are the first line of defense against breast cancer. So it's still the gold standard for detecting breast cancer early. So as you spoke to it, 1 in 8 women will be diagnosed with breast cancers in their lifetime. And also, while Caucasian women are more likely to develop breast cancer, African American women actually die more from breast cancer just because they don't seek out early detection and early treatment. So education, I'm finding just through working in this, I've been at the hospital for 19 years and I've been in breast health for 12 of those years. I was the first African American mammo tech at the hospital. And so, just in talking with patients over the years, there's really a lack of just knowledge and knowing the importance of getting screened early. So, I feel like my role and my passion is to just educate people wherever I go about the importance of getting mammograms. I get stopped in Walmart, I get messages through my messenger on Facebook just about people, how can I get treated, or what do I need to do, or I have this problem, what should I do? So that's the message, early detection is key. And then another important thing that we really need to take a look at closely is male breast cancer. I feel like that statistic is going to really change in the next few years because we're seeing more and more males diagnosed with breast cancer. So that's going to be an important topic that you'll hear really hot in the news coming up.
Well, let me ask you this. Now, is the do men take mammograms too? Can that same process detect breast cancer in men?
So men typically will not get screened for breast cancer. Typically, when a male comes to us because they feel a lump in their breast, they feel something. We typically, if a male will get screened for breast cancer, it's because he has a strong family history of breast cancer. And so that's when you typically see males get annual screening if they have that strong family history. But otherwise, they have to feel something to know that there's a problem going on. So it's important to even educate the males to be in tune with your bodies. And if you feel something, say something and speak up about it so that they can get treated early as well.
So there's a different process, to diagnose and determine whether. And then I'm interested in that. We're gonna get back to the women because it's extremely important. So there's a different process that's utilized to determine breast cancer in men.
Yes, like typically, like I say, they will find a lump in their breast, but they'll come in, they get the mammogram too. They have to have a mammogram. If they find that lump in their breast, they'll have a mammogram, they'll have an ultrasound, and then if needed, a biopsy to determine if they have breast cancer. And
Okay.
most of the time it's not breast cancer, but like I say, lately we are seeing an uptick in men across the United States with male breast cancer.
Well, I've heard of some famous guys, some
Yes.
well-known guys having breast cancer, and I'm sure that we need to familiarize the community with that process and what's happening with that. So that's very important. So now, when should we need to talk about the mobile? Because I want to talk about the details and the route and where it's going to be and things of that nature. But let's kind of streamline who should be tested. So we want to establish that first, and then we want to set up the mechanism wherein we're going to make it easy for them to get that mammogram because, like I said, we got it on wheels now.
Yes.
We got it on wheels. But talk a little bit, and I think I saw somewhere anybody over 40, but I'm not that kind of expert. Just tell me, because what we want to do is prick the conscientiousness of the community as it relates to breast cancer. So, who should be tested and probably when?
So women over the age of 40 should have an annual mammogram every year.
Wow.
Women under 40, women between age 35 and 40 should talk to their provider because if they are at a higher risk, they should start screening early at 35. We're seeing a lot of younger diagnosis as well of breast cancer under 40. Most insurance will pay for a woman to have that baseline mammogram at age 35. If that's fine, she could start back at 40. But we do recommend every year for women over the age of 40. And the reason why, if a woman has a breast cancer in their breast, it's going to take 6 months for that breast cancer to grow. So by them getting screened annually, we're going to notice a change in their breast from year to year. And so by you getting screened annually, if there is a change, then you can get treated early. And as you said, the outcomes is better. Breast cancer is no longer a death sentence as long as you're getting screened early and you're getting treated for early. So that's the key.
And the other interesting thing about cancer, and the reason that this is so important, is that oftentimes, sometimes they call it the silent killer, and it could be developing and growing in your body and you not know it. So, I mean, I don't think we need to emphasize anymore that, one way that can prolong your life, possibly, and improve your quality of life and improve your possibility of being healed is to get tested with this mobile mammography instrument. So talk a little bit about it, the mobile vehicle.
So I'll give you some backstory on the mobile mammography coach. So back towards the end of maybe the middle part of 2022, I was tasked with writing a grant through Senator Warnock's office for a mobile mammography program in our area. And we did receive notification in 2023 that were awarded $2 million to build this program. And so fast forward, a lot of hard work, a lot of blood, sweat, and tears went into this project, not just from me, but from other people within the hospital that helped be a part of this program. So we're excited that on Christmas morning of December 2024, the mobile arrived on Hemlock Street. And so this program is going to bring life-saving mammograms directly to the community where women who can't possibly get off of work. One of our big targets is teachers, because teachers, we found over the years, they tend to come get their mammogram when they're going out for break, not thinking. They'll come get them right before school starts when their break is over. And they don't think, what if I need additional testing? And so we want to get these teachers on a cycle where we're bringing it to them so they don't have to take off of work. It's hard to get substitute teachers, as we know. And so we're bringing it right to them, and that way they can run out for 15 minutes, get their mammograms in a private, comfortable setting, and go right back to their classroom. And so we have partnered with several school systems, Bibb, Jones, Peach, Twiggs, Wilkinson County school systems, to bring this directly to the school systems, to these teachers and the employees of the school systems. So access to care is one of the big reasons why this project is so important, so that we can bring it directly to the community. And then the other part of it is educating the community about the importance of getting mammograms, because many people, I was talking to someone earlier this morning, they thought that they should be having their mammograms every 2 years. And so educating the public about the importance of getting screened every year for early detection, that is what this mobile mammography program is going to do for the community.
Well, the mobile is very important. I want to talk to you. We need to discuss prior to, the show being over, if in fact some large employer or whatever. I think that's such a great initiative. And so we need to talk about what it takes, for, to get that mammography vehicle, at a location or to an industry or business or corporation or what have you. And I think that's such a phenomenal gesture. And I want to publicly thank everybody who was involved in that process, because both you and I know that it's going to save lives and it's going to improve the health of the entire community. So I applaud that. So let's talk about, since we're talking about mammograms, and since we're talking about women over 40, and sometimes women, as young as 35, and since we're talking about the fact that 1 in 8 would definitely get some form of breast cancer or what have you, what about outside of the mobile mammography? What's the process wherein maybe a woman does not need to go to that vehicle to get tested necessarily, but want to, be checked, want to get a mammogram? So what's that process?
So women should monthly be doing their clinical self breast exams monthly. Every woman should be doing that, actually starting in their 20s. And so, but let's say you want to just come into our traditional brick and mortar. We have the same equipment on the mobile that we have in our brick and mortar locations. We have 5 locations throughout Middle Georgia. Screening mammograms are done at all of our facilities. Most facilities will allow walk-ins. We will file insurance for our patients, but we have found that a lot of our patients are uninsured. And for those that are uninsured, we do have grant funds that will cover them so that there's no excuse for them not to get their mammogram.
Okay, well, how can one find those locations just in case?
So to schedule a screening mammogram at one of our brick and mortar facilities, they would call 478-633-7020. That's our centralized scheduling, and they'll get them scheduled for a mammogram.
So that's important. Just off the top of your head, you may or may not know. Um, can you recall any occurrences where mammograms have really helped somebody, and people have, and I know that's the purpose of the mammogram, is to discover it, but sometimes there are some stories that go along with the importance and the success and the relevance of getting mammogram. Just off the top of your head, do you know of any?
Oh, yes. So we've had patients tell us, all the time that this mammogram saved their life. Had it not been for the technology and us finding their cancer early, they probably would have died. And so we have, through this mobile program, just since we've been out for 2 weeks now, we've heard so many stories, feel-good stories, where the patients are saying they were able to get their mammogram right on their job. It had been 5 years since a patient had had a mammogram. We've also had patients who had not had one before. And so otherwise, and they've told us, I probably would have never got this if you had not brought this mobile to us, just because of the timing that it takes to take off of work.
Well, and I know that probably, and we don't have to reveal it, but I bet you, if in fact it has not discovered somebody who needs to be tested further, it will. So it's just extremely, extremely, extremely important. Now, what about, what is the process? Say, for example, if it's possible, say for a church or an organization or a nonprofit. I think that would be a phenomenal initiative, particularly organizations and institutions that are concerned about general health, but particularly women's health. And they say, well, hey, at our event, at our expo, at our convention, at our conference, one of the activities that we would like to see is to provide a service to the community by having this mammogram vehicle at the vehicle. Does it have that kind of flexibility? Is scheduling it possible?
Absolutely. And we've already partnered with several churches throughout Middle Georgia to bring the mobile to the church and the community. So we partner with Macedonia. We partner with Union Baptist Church. We partner with Glorious Hope and Beulah Land Bible Church as well, so that when they have their health fairs, we'll be able to take it directly into those communities and get women screened on the mobile coach. We've also partnered with the health department and some of the parks and recreation departments as well. So when they're having their activities, we'll have the mobile out there because we want to take it. It's already mobile, but we want to make sure we reach outside of the walls and those out of the box places where people are going, like just for recreation, even just in that way they can see the mobile and it'll prompt them, hey, I need to get a mammogram, or we can educate them about the importance of getting a mammogram where they live and where they're working at.
Wow, and that is so very, very important. So I guess what you're saying is that the best way to detect, now we're going to get back a little bit on the men cancer because of breast cancer, because I don't think that, we can't overemphasize that. And so the two ways, and correct me if I'm wrong, first of all, everybody should get it once a year, should be get a mammogram once a year. Okay, but in order to and the other process, other than the mammogram, is the self check for to see.
Correct.
So evidently, there's no, and then it's kind of sad, but I think that there's no real blood test. I mean, I heard that somewhere that there's no real blood test to
There
detect.
is genetic testing that you can have to let you know your risk for developing breast cancer. So there is a blood test through genetics that you can have. And we do offer that here at Atrium Health Navicent as well.
But see, a lot of people don't even know about that. A lot of people don't even know about the genetic testing because, for not only breast cancer, but other kinds of cancer. So that's really, really important information. Now, let me clear something. I'm a little confused, and it's not because you were confusing me. It's just I didn't catch it right. So a male can cancer in a male's breast can be detected through a mammogram. Is yet true or false?
That is true.
Okay. So a male can go in to check, but the best thing, and he too should self-examine to see if, in fact, there's a lump. So a man as well as a woman get the lump.
Correct. And a male wouldn't be getting screened, remember, every year. So the males really need to be checking their bodies to notice any changes because they're not coming in every year for a screening. Typically, with a male, it's because they find something, they feel something. And so that's when a male would notice. But if they're checking their bodies monthly, and we're encouraging that now with the males as well, because we've had males in the past tell us, well, it was from working out at the gym. I strained a muscle in my chest, not knowing that that was a lump and they needed to work that up. And so it's very important for males to also be in tune with their bodies and their chest area and feel and check monthly as well for any changes.
Thank you so very much. This is a call to action. I'm your host, Alex Habersham. Just wanted to reintroduce Miss Latasha Hill, who's bringing us this very exciting information about mobile mammography. I can pronounce it. Wow. Mobile mammography, which is very, very important. So if you would just take 2 or 3 minutes to just kind of overview the fact that it's available and who it's available to and how to engage with whomever to get it done, and also talk a little bit about the importance of getting tested.
So as I said, we've launched this new mobile mammography program, and this is going to be a bold step in breaking down those barriers that women face in our community from getting mammograms. You find obstacles like transportation, financial concerns, even just you can't get to a facility. And so this is going to take this routine test to the community and directly to companies, to churches, to communities, to places of business, so that there won't be an excuse where you don't feel like you can't take off to get your mammogram. So this is going to just bring the same high quality service that we offer in our brick and mortar facilities directly to those underserved neighborhoods as well and rural communities.
That is so outstanding. So would you give that number again? Okay, is it the same number for people who want to learn more about the mobile mammography as it is for people who want to know about the brick and mortar, or are there two different numbers?
There are two different numbers. To schedule any organizations that's interested in us coming out to bring the mobile mammography coach, they're asked to call 478-633-2003.
Okay, what about brick and mortar?
Brick and mortar locations, 478-633-7020.
Outstanding. Well, this is a call to action. I'm your host, Alex Habersham, and so glad to have Miss Latasha here. Now, what's your long title again, Miss Latasha?
I am the breast imaging service line manager here at Atrium Health Navicent.
No way I could have remembered all that, but I'm so happy to have had you on the show. And, as a final word, there's an old expression that says, don't just stand there, do something. So if you have information, we all want to be healthy. We all want to live a long time. And then we all think that it won't happen to us, but it will. And, it makes sense to be sure. So I'm so happy and so proud that you all have initiated this program to get these mammograms done all throughout the community. But I'm equally as happy that you have reminded us, both men and women, that we need to be tested and need to be aware of the fact that that breast cancer is possible, and that there are ways to detect and to get early detection and to get treated. The earlier, the better. So thank you so much for imparting information. This is a call to action. I'm your host, Alex Habersham. Have a great day.
www.makingblackpages.com.
Monster Jam.
Is roaring into the Macon Coliseum April 18th through the 20th with 4 awesome shows featuring Monster Jam trucks, world champion drivers, freestyle competitions, gravity-defying stunts, and heart-pounding races. The whole family will enjoy lots of action and excitement.
Coming to Macon Coliseum.
Start the fun early at the Monster Jam Pit Party. Get revved up with Monster Jam Trackside Experience. Meet the superstars of Monster Jam. The competition is fierce as 8 top drivers battle it out for a spot in the Monster Jam World Finals. Don't miss the 2025
Monster Jam.
coming to the Macon Coliseum April 18th through the 20th. Tickets available at Ticketmaster, or get your tickets now for only $12 with coupon. Use offer code MJMBP. $12 coupons are available at
Macon Black Pages.
For more info, visit monsterjam.com.
Monster Jam.
As big as it gets.